Now, this is a question I get a lot of the time, and it is talking about belly button pain during pregnancy. So what causes belly button pain? Is it a problem? And what can you do about it? Plus, we're going to talk a little bit about the Innie and the Outie of belly buttons during pregnancy. So stay tuned. Now, surprisingly, as a nurse for so many years, I didn't get this question too much at the bedside, and I think it's kind of an afterthought for a lot of people. They think of it when they see me online, but they don't think of it when they're in the office because in general, it doesn't tend to be too much of a big deal versus like ligament pain or symphysis pubis. By the way, if you're looking for the pains of pregnancy, I have some videos about that. I'll link them down below. But today, we're just going to reference belly button pain. Now, I don't know if any of you guys know this, but your belly button is where the placenta was once attached to your mom. So the placenta with all of its arteries then attaches to your belly button. We cut the cord and then your body heals it to your belly button. Now, why would it be painful during pregnancy? As the uterus grows, it's growing behind it and it puts pressure on it like we don't normally see during our regular life. And our muscles tend to cover it, you know, like little doors right here. And you can get something that's called an umbilical or umbilical hernia. And it's just where your muscles have separated a little bit around your belly button and your intestines are starting to like peek at the door. Now, for most people, it isn't a big problem. It's just that small separation. And after you have your baby, it's going to go back to normal and you aren't going to have this problem again. It is something to keep an eye on. It can be a big problem, but most often it isn't, but it's something to keep an eye on. Now, that is usually more a sharp pain right around your belly button versus more of an aching type pain. And I'm here to tell you that if you have any new pains during your pregnancy, I think it's important to bring those up at prenatal checkups. I, of course, recommend that you have a running tally of questions that you keep in your notes app so that you're not having to call your provider all the time for things like this. But I think it's important to bring it up because they should assess to make sure that it isn't a problem and that hopefully they can assess it also postpartum to make sure that everything has come back together. Now, belly button pain can also be caused by the stretching of your uterus as it enlarges, and stretching of your uterus can also cause the hernia pain. So, you know, they come together. And sometimes round ligament pain can feel like belly button pain as well. And again, I have a video about ligament pain I'll link to down below. So for not everybody is it that hernia pain, but I think it's important to mention it to your provider in case that is the problem, because it's something they'll need to keep an eye on. Now, when would this type of pain start? I feel like your baby grows in spurts. And so when you have those spurts, you're more likely to have the belly button pain. You're more likely to have that ligament pain because your uterus is expanding at a higher rate than it had been. So people at like 20 weeks of pregnancy will complain about ligament pain or that belly button pain, and then it kind of goes away. I think it's because that baby has had kind of a little growth spurt in that time frame. And you'll notice that even when baby is out, they'll still have these growth spurts. You think a size 2 diaper is fine, but then all of a sudden they need a size 3 almost overnight. Now, the one thing you're going to want to check for is that you don't have a lump there, because that could indicate that your intestines are starting to spill out. So if you're having that belly button pain, just gently feel it. You don't want to press hard, just to make sure that there's no lump there. Now, I have seen them do surgery if it was extremely problematic. Most often they don't need to do it. And most often they don't need to do it even in postpartum because you know, you don't have a big uterus anymore. Those muscles go back to normal. And using physical therapy can be helpful to train those muscles to go back together. I don't know if you've heard of something called diastasis recti or diastasis recti. I'm not sure exactly how to pronounce it, but it is when those muscles separate and can cause things like umbilical hernias or other problems. And then after, there are exercises that you can do to help those muscles come back together like before you got pregnant. But I think it's really important to use either a great personal trainer or a physical therapist to give you those exercises, because you don't want to go right into sit-ups right after your postpartum. In fact, you definitely want to wait those 6 weeks and get good advice from a professional. Hey, I did want to mention that in the online prenatal class for couples, we actually have like a beginning ab rehab taught by people who do the ab rehab course that I'm doing right now. And I'll put the link for that course down below because it can be really helpful. And it's something to just like keep in your head for after baby's born. It's so good to get help to build that core back to the way it was before. Now, if you're having this pain and your provider's just like, yeah, you have a tiny hernia, probably it should resolve, what can you be doing about this annoying pain? Because it is super annoying. First thing, avoid tight-fitting pants, and especially anything that crosses that line makes you go up, or they're the low riders. Same for your underwear. You can also use something like a warm compress You don't want to do anything hot because then it's over the uterus, but you could do like a washcloth with warm water to see if that helps those muscles relax and chill out a little bit. And there might be some gentle exercises you can do. Again, your provider can't solve everything in pregnancy, but they should be the key master to say, hey, you might want to go to a physical therapist or a chiropractor or have someone that they can recommend to help you manage your life with this new thing of pregnancy. The other thing you're going to want to do is make sure that you're preventing constipation as much as possible. That means drinking more fluids and eating more fiber. Talk with your provider if you want more information on how that would be good for you. If you're diabetic, it's a little bit trickier, but if you're in your 36 weeks plus, check out my post about eating dates during pregnancy because that can increase your fiber for sure. I'll link it down below. By the way, I just saw an entire class made by somebody about eating dates during pregnancy, and I was like, how long is that class? Why is that useful? So I'm just saying that if you want to learn about dates during pregnancy, I have an article about it and it links to all the studies and gives you some ideas about how you can incorporate them into your diet if you don't just want to like chow down on dates. Another thing you can try is one of those maternity belly bands that kind of give a little bit of support to your belly. There's ones that have suspenders. There's other ones that you just wear below that, and that can take some of the pressure off of the downward forces of your belly, and that might help your umbilical pain. I actually have a whole post about using maternity bands, and I'll link that one down below as well. And sometimes you get like a little itchy because you've got that pokey outie. So using something like cocoa butter to make sure that the skin is well moisturized can really help that area as well. You don't want to be bugging it or itching it if you can prevent it. Okay, finally, why do some people get an outie belly button during pregnancy? I know that if I was wearing a tight fitting dress, I stuck a band-aid over my belly button because I felt it was awkward to have my little keyhole belly button hanging out there. It's just from that uterus expanding. Your belly button is made up of some ligaments and tendons that helped it, you know, before you were separated from your mom. But as those get pushed by the uterus, they push out as well. And so you get an outie, and it will most likely return to an innie after you have your baby. And as your baby's umbilicus heals, you will find that their belly button starts as an outie and then may go to an innie. It's really just dependent on the muscles and what's going on in their belly. Now, if you have a piercing, talk with your provider. You may want to be taking that out. When I was in college, I actually had a professor who did a study on umbilical piercings and showed that it can be like a starting point for stretch marks. So talk with your provider if you have a piercing in that area. Honestly, if you have a piercing in any other area besides your ears, talk with your provider because it may be best that you take it out during pregnancy. It just depends. Pregnancy is full of so many weird things, but one of the ones that a lot of people get is ligament pain. I have a whole video about it I'm going to link to up above. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared for your upcoming hospital birth and weird stuff of pregnancy like belly button pain.